This conference will now be recorded.
Good morning, students. Thank you once again for attending microbiology. Today, we're going to learn about respiratory tract infections. So, what actually are respiratory tract infections? Respiratory tract infections refers to any of a number of infectious diseases involving respiratory tract. So, what are it is an infectious diseases involving respiratory tract. And they may be classified into two different types. First one is upper respiratory tract infections. Next one is lower respiratory tract infections. So, upper respiratory tract infection, can you see the parts? What are they? Sinus, nasal cavity, nostrils, nasopharynx. All these are a part of upper respiratory tract. Next is lower respiratory tract. The lower respiratory tract consists of about bronchi, bronchioles, alveoli, etc. So, depending upon the which part of the respiratory tract infection takes place, there are so many types of respiratory tract infections. Next one. Normal commensal flora. There are certain bacteria which usually form a part of normal flora. Okay, and so they are usually commensal flora. The different organisms are alpha and gamma hemolytic streptococci. So you have known streptococci? Yes, you have learned in systemic bacteriology. Streptococci pyogenes. What type of a streptococci is it? Alpha, beta, gamma. Which one? It is a beta hemolytic streptococci. Okay, whereas commensals are alpha and gamma hemolytic streptococci usually act as commensal of normal flora. Next one. Beta hemolytic streptococci other than group A. Beta hemolytic streptococci itself is further divided into so many groups. Out of that, except group A, majority usually form as normal flora of respiratory tract. Next one is Candida species. Next, coagulase negative staphylococci. Next, Corynebacterium species. Next, Haemophilus parainfluenza and Neisseria species. Next one. Potential pathogens of respiratory tract. We have learned about commensals. Now, what are the pathogens? Bacterial pathogens, pneumococcus, pneumococcus. By the name itself, what does it cause? Pneumonia. Next, Haemophilus influenza, Mycobacterium species. Streptococcus pyogenes, which is a beta hemolytic streptococci and belongs to group A. Staphylococcus aureus, Pseudomonas, and so many other bacteria. They usually act as Next one, viruses. So, which are the viruses which usually cause infections of the respiratory tract? Respiratory syncytial virus, rhinovirus, adenovirus, Epstein-Barr virus, influenza and para-influenza virus. There is another one virus which is now making a havoc in our community all over the world also. What is it? Coronavirus. Okay. So all of these viruses cause infections of respiratory tract. Next one, fungal pathogens. Cryptococcus pneumoniae, Pneumocystis jirovecii, Aspergillus, and Candida albicans. Next, different agents, their group, their effect, and what are the clinical features. So these are the common bacterial agents which usually cause infections and in which age group they cause. Okay, first one is Bordetella pertussis. It causes paroxysmal cough in infants and young children. Cornybacterium Whereas Staphylococcus pyogenes, Streptococcus pneumoniae, and Streptococcus pyogenes causes respiratory tract infection in all age groups. Next, viruses. So, enterovirus and influenza ADC usually affect all age groups. Measles, parainfluenza virus, mainly children. Respiratory syncytial virus, infants and young children. Rhino and coronavirus, all in its common cold. Common cold is the most common type of respiratory cold, not only caused by influenza virus, it also caused by coronavirus. Coronavirus is not a new one. It's a very, very old one, which causes common cold. Okay, but since now the pandemic has been involved, we have come to know that this coronavirus is one of the one which causes respiratory tract infection. Coronavirus has been present long time ago. We only know that common cold may be caused by some influenza. You usually call it as a flu, right? Flu. Flu is not only caused by influenza viruses, rhinoviruses, or paramyxoviruses, but it's also caused by coronavirus. Next, protective factors of host against respiratory tract infections. There are certain factors in our body which usually protects us against respiratory tract infections. So respiratory tract infection, through how do we get contacted? Through our nose, right? First. So first defense parts which are present in our nose are nasal hairs. Next, convoluted passages and secretory immunoglobulin A lysozyme. All of these usually act as protective factors. Next, normal flora of the nasopharynx and oropharynx. Next, we are going to learn about lower respiratory tract infection. Lower respiratory tract infection usually majorly lead to inflammation of air passages within the lungs, trachea, and the large and small bronchi within the lungs. Okay, can you see the diagram? Part of the lower respiratory tract infection. What are they? Bronchi, which is further divided into bronchioles, alveoli. All of these are a part of lower respiratory tract. So, if any one part of it is infected, it will lead to lower respiratory tract infection. So, depending upon these, infections of the lower respiratory tract include bronchitis, bronchiolitis, and pneumonia. First one is bronchitis. What is it? It is the inflammatory disease of the bronchi. Peak of onset 6 months. And infection is commonly seen during winter season and spring season. While winter and spring. Winter, very cold. Okay, spring, it's not cold, but why? What happens in spring? New leaves are formed, right? Allergy, you get allergy because of it. So, bronchitis mainly in winter and spring. And there are two types of bronchitis, depending upon the severity and duration. They are acute and chronic. Okay. Next, what is acute? Acute means recent. Acute bronchitis is an inflammation of the lower respiratory passages. So, if it usually lasts for a short period of time, and there is inflammation of the bronchi, which is usually called as acute bronchitis. But if the bronchitis usually lasts for several months, then it becomes bronchitis. Okay? So it is usually lasts for a short period, it is acute. It is lasts for a long time, it becomes so acute bronchitis is an inflammation of the lower respiratory tracts, whereas chronic is defined as a cough that occurs every day with sputum collection that lasts for at least 3 months or 2 years. Causes. Why bronchitis takes place? Causes. Why? It is bacteria, fungi, viral, or any other factors. What? Yes, mainly viral infection. Next, bacteria. Not only microorganisms, but chemical agents can also cause bronchitis, such as smoking tobacco, as well as gastric infection. Okay, so they may also cause scientific Okay, next one is treatment. So how is bronchitis treated? By using aspirin and ibuprofen. So these are the most common drugs which are used for the treatment of bronchitis, as well as if a person is having allergy conditions, antihistamines are recommended. Next one, bronchiolitis. It is the inflammation disease of the bronchioles. Peak age of onset for about 6 months. Male and female ratio is present in the ratio of about 2:1, and it mainly takes place during winter season. It is mainly caused by respiratory viruses such as respiratory syncytial virus, parainfluenza virus, type 1 to entry. Bacteria usually serve as secondary pathogens in minority of cases. Signs and symptoms. What are the signs and symptoms? There is usually restlessness with mild fever, coffee stain, sometimes vomiting and diarrhea is also there. When you breathe, there is a noise, sound, okay, will come. When you're breathing also, wheezing sound will become. And increased respiratory rate as symptoms progress. Treatment. Treatment of bronchiolitis is mainly supported. Next, since there is breathing problems, often oxygen inhalation had to be. Next, there is also vomiting and diarrhea, right? So, parenteral fluids to limit dehydration. And also to correct respiratory expenses and electrolyte imbalance. Next one, there is breathing problems as well as sound produced while breathing. So, bronchodilators are usually given in order to reduce this. Mainly nebulized adrenaline. Next one, pneumonia. Yes, you all are familiar with this, right? Which is a bacteria that mainly causes pneumonia, Streptococcus pneumoniae. Okay, now what is this pneumonia? It is the inflammation of the lung parenchyma and is associated with the consolidation of alveolar spaces. So, it's the inflammation of the lining of the lungs, as well as the alveolar spaces are affected. Children are usually considered as high risk in acquiring pneumonia, mainly 2 to 6 months of age. And also, if any parent is working at home, or if a child is born prematurely, or low birth weight, or if the child is given breast milk for less than 6 months of age, all of these may influence the appearance of pneumonia. Infection rate is higher in siblings of small children. So these are the lower respiratory tract infections. So how many types of lower respiratory tract infections have you learned? 3 types. What are they? Bronchitis, bronchiolitis, and pneumonia. Next one, upper respiratory tract infections. Upper respiratory tract infection is an illness caused by an acute infection which usually involves nose, sinuses, pharynx, or larynx. So, depending upon this part, the infection may be otitis media, sinusitis, pharyngitis, laryngitis, tonsillitis, rhinitis, diphtheria, epiglottitis. So all of these will come under upper respiratory tract infections. What is otitis media? What is this otitis? It is usually, there is a tube which is usually present between the nasopharynx and middle ear and air sacs. That is called as eustachian tube. Okay, usually children have shorter and wider tubes than adults. Therefore, they are most commonly infected and acquire otitis media infection. The bacteria which most commonly causes otitis media are Streptococcus media. Can you see this? Look at the 2 diagrams. Otitis media, right and left. One picture is normal, another one is bulky. So bulky is a common characteristic feature of otitis media. Signs and symptoms, pain that can be severe. Yeah, otitis media means in the ear there is pain. Children may be irritable, and there is pain in the ear, they may tug the ear, and there is difficulty in sleeping. When you examine the ear, there is bulging of the ear drum. Next one, sinusitis. Have you heard this name? Yes, this is the most common type of upper respiratory tract infection. Sinusitis. Sinusitis may be community acquired as well as nosocomial type. Community acquired is usually caused by bacterial agents such as Streptococcus pneumoniae, Haemophilus influenza, and Streptococci pyogenes, whereas nosocomial is caused by Staphylococcus aureus, Pseudomonas aeruginosa, and Serratia morris. Others are fungi. All types of molds, yeast may usually cause allergic reaction, which can lead to sepsis. So, can you see the parts of the sinus? Signs and symptoms of sinusitis. This also is again divided into 2 types. They were acute and chronic. Acute. In the case of adults, it is usually characterized by nasal discharge or congestion. And since it is usually spreads to the maxillary sinuses also, there is tooth pain. Maxillary tooth pain, facial or sinus pain may radiate. It may be severe or persistent. Often, this acute can be treated with antibiotics. Children, there is nasal discharge, but which usually lasts for more than 15 days, as well as there may be fever. It can also be treated with antibiotics. Next one, chronic. In chronic, the symptoms are same to that of the acute, but more non-specific. And here, it is characterized by non-productive cough, laryngitis, and headache. and may usually last for about 3 to 4 days. Next one, pharyngitis. What is pharyngitis? As the name suggests, it is the inflammation of pharynx. Most cases are usually viral. So pharyngitis is mainly caused by viruses, bacteria such as Streptococcus pyogenes and also it is characterized by sore throat. The throat will be painful or you may get an itch. Okay, when you breathe also you will get itch. When you swallow, it will be painful. Significant symptoms of pharyngitis: sore throat, pain on swallowing, fever, headache, nausea, vomiting, and abdominal pain. Erythema or inflammation of the tonsils, with or without patches. Sometimes there is enlargement of lymph nodes, which may be tender, and red, swollen uvula. Keep in mind, the uvula will be swollen and red, therefore we often get itching. Next, common cold. Common cold is commonly known as rhinitis, mainly caused by viruses. Okay, which virus? Mainly paramyxoviruses and influenza virus. Children average 8 episodes per year, whereas 3 episodes per year. The various agents which cause common cold are: first one, rhinovirus, which account to about 30 to 35%. Next, coronavirus to 10%. Other viruses such as paramyxoviruses and other viruses 20%. Influenza and adeno 30%. Streptococci 5 to 10%. Next one is seasonal variation. Rhinoviruses mainly cause common cold in early fall during beginning of the season, whereas coronavirus mainly in winter season. Common symptoms. The common cold, right? When you get a cold, what are the common symptoms? First symptoms, what is it for the common cold? First one is sneezing, right? Next, sneezing, okay, your nose will be infected. It may be either runny nose or not runny nose. Often there is nasal condition, right? Next, after 1 to 2 days, even your throat will become infected and your throat will become painful. So that is called as throat. Sometimes you may also get eye infection. Why? By your contaminated hands, if you scratch your eyes or if you contaminate your face, automatically you will get symptoms. Okay, it may also be accompanied by fatigue and madness. Next one, tonsillitis. Tonsillitis is a viral or bacterial infection in the throat that causes infection of the water waste. Tonsils are small glands in the pharyngeal area. So, what are tonsils? These are small glands in the pharyngeal cavity. Lymphoid tissues are there in this pharyngeal cavity. When they become inflamed, they usually grow in size and become painful. Okay, so in the first 6 months of life, Tonsils provide useful defense against various infections. And tonsillitis is one of the most common units in preschool children, but can also occur in different types of. What is the first major symptoms of tonsillitis? Sore throat. Next, fever. Sore throat, feverish day. The throat will be very painful. As a result, we cannot swallow properly. As a result, the person will not take food. So these are the symptoms of tonsillitis. So what are the symptoms? Pain in the throat. Right. The throat is infected, so it will be reddy color. Next, the person may be suffering with fever, so possibly high temperature. Swollen lymph glands under the jaw and in the neck. Next, headache, loss of voice or changes in voice. Next, treatment. How will you treat? Person who is suffering with tonsillitis are encouraged to take their rest. And since the throat is very painful, and since the person is not able to take solid food, introduce soft liquid diet. Next, warm saline gargles is best when you get up in the morning, as well as when you go to bed. Gargle your mouth with lukewarm water consisting salt and turmeric. Okay, and then if you are healthy also, if you gargle every day, it will usually keep you safe from majority of respiratory tract. Medicines such as paracetamol can be used. If tonsils do not subside, compulsory they have to be removed surgically within 3 or 4 years of age. Because as a person grows, there is a possibility of regrowth or hypertrophy of lymphoid tissue. Next one, diphtheria. You have learned about this, right? So diphtheria is caused by which bacteria? Corynebacterium diphtheriae. And it produces what toxin? Diphtheria toxin. Next, croup. What is croup? Croup or laryngotracheobronchitis. It is characterized by cold, sore throat, mild cough, and fever. It may be caused by influenza and para-influenza viruses. Next, laboratory diagnosis of respiratory tract infection. So, respiratory tract infection, laboratory diagnosis. First one is specimen collection. What are the different types of specimens which you collect? Sputum, nasopharyngeal swab, posterior pharyngeal swab, sinus washings, tracheal aspirate, bronchoalveolar lavage, bronchial washings, as well as that also can be collected. Okay. Next, sputum collection. How will you collect sputum? Before collecting this sputum, we have to advise the patient not to take any footsteps 1 to 2 hours before. Often the mouth has to be rinsed with saline and the patient must cough deeply. Okay? He should take a deep breath and cough and collect sputum. Remember, sputum is not saliva. Sputum and saliva are different. You have to differentiate between sputum and saliva. If the person collects saliva and sends to the lab, it is wrong. You have to compulsory collect sputum only. Next, transport in container immediately to the lab and perform gram staining and culture as soon as possible. Once you get the specimen, immediately do gram staining, okay, and inoculate into culture media. Gram staining for bacteria. You see if there are any bacteria. See if it is a gram positive or gram negative. Try to differentiate immediately for preliminary tests. Next one, sputum ready. Sputum ready. Immediately when you get sputum, wet mounts are also performed. Wet mounts are performed in order to see for the presence of neutrophils as well as epithelial cells. Depending upon the presence of neutrophils and epithelial cells, the sputum can be traded from 0 to +1 or +2. A final score of 0 or less indicates either lack of inflammatory response or salivary contamination, thus invalidating risks. Next, isolation of viral pathogens. Yes, these respiratory tract infections are also caused by virus. So after collecting the specimens, you have to isolate the virus by using different cell lines or by using antigen testing or antibody testing or PCR methods. In the case of fungal pathogens, you can inoculate the specimen on fungal culture media such as Sabarodes dextrosaccharide. Next one, coronavirus. There are many different coronaviruses. Most of them cause illness in animals. However, 7 types of coronaviruses are known to cause illness in humans. 4 of these 7 coronaviruses involve respiratory tract infection that cause symptoms of the common cold. However, 3 of the 7 human coronavirus infections can be much more severe and have recently caused major outbreaks of fatal pneumonia. So, coronavirus, the present coronavirus is SARS-CoV-2, right? Other